guys. Just wanted to give some quick tips and things you can work on for knee issues. And in particular, I had someone ask me about kind of strengthening the ligaments of the knee. So one thing we can all do is bring more awareness to the alignment in our knees. So just to start, you can take a rolled up mat or a foam roller and put it behind your knees. And just have a neutral spine. You can have your hands behind you if you want. And before we do anything, kind of let your legs relax. And then, without looking at them too much. And then when you feel like they're their natural position, then you're going to look down and see which direction your kneecaps are pointing. So for most of us, if it might be from something happening in your hips, tightness or unevenness, and also it can usually start in the bottom, especially in a standing position. You'll check this as well and see if it changes, because then it could be something in your feet and ankles that is affecting you higher up. That's where it tends to be, but in a seated position, it could be the hips as well. So you're gonna see, so for me, a lot of times my right knee will kind of be in. I'm gonna exaggerate it a little there so you can see it. So I'm going to work on all of my poses, trying to keep those kneecaps straight forward or straight up, depending on what direction I'm facing with my knees. And I also want to take a peek at my toes, and you always want your alignment of your knees usually to be right in the center of your foot, between your second and third toe. So you're going to be really careful about that alignment if you have any knee issues. So this first little exercise, again, you can bring your hands behind you if you want, and you're just going to press one knee at a time. You can bend the other one and kind of just relax it. Then you're going to press the other knee straight down into the mat. And as you do that, I want you to recheck your alignment and notice, did the knee just slightly go off to the outside? Did it go to the inside? And see if you can make adjustments, either rolling the inner thigh down, pressing straight down, so that you can get that kneecap just right. And you can hold that for 10 seconds, and then you'll switch and do the other side, because it's interesting to note the differences in the sides. Okay, so you'll do that. Then another one I like to do, and if you've done physical therapy, you've probably done this one, is against a wall. I can post here. And you're going to walk your feet forward. Now, some people have the alignment where you have knees over the toes. I would suggest keeping the knees over the ankles, especially to start. So you really want your spine neutral here, so press your lower back towards the wall behind you. And have the toes point straight ahead, and just slowly start to bend your knees. And watch your knees as you do that, and notice if one of them kind of opens or falls in. Try to keep them straight. And if you get far and you realize, oh, I need to walk my feet forward, do that. If you need something for balance, have a wall or chair next to you. So again, I'm going to check my alignment. I like to start with the feet hip distance, but equally apart. And then you're going to think about rolling your inner thighs in slightly, but notice if the knees fall in too much. You might need to compensate that by lifting your inner arches up. So you use those two motions, those two movement principles, to stay in alignment with your knees. And a nice addition to this is to take a block, something like that, between your thighs. And you're not necessarily squeezing it tight. Think of inner rotation of the thighs down towards the mat, so it's like you're a little Pez dispenser. And you are squeezing, but you're more sending that motion down towards the floor. And if you do that too much, you'll collapse in those inner ankles, so you're going to lift the inner arches up. And also think about squeezing the ankles towards one another. And then you can make your way down to 90 if you feel comfortable there, and you'll come back up. And you can either repeat that exercise in and out and just be really conscious of the alignment of the knees, or you can hold it. And then a forward fold is another nice place to just check your alignment. So try to have the feet hip distance, toes straight ahead, not turned in or out. And then you're going to bend your knees and slowly pivot at the hips here to forward fold. And as you come down, take a peek at those kneecaps and see if one or the other, maybe it just very slightly turned in or out. You can check your ankles while you're down here too and see if you need to lift one more than the other. So really be aware of your alignment there as you move. And you can also do that one with the block between the thighs, same position here. And you think of inner rotation of the thighs back, lifting your inner arches up a bit to keep that in balance. And then the last one I'm going to give you takes a bit to set up. So I have the luxury of props here, but you could use any pillows or anything you have on hand. So something for your back maybe there against the wall. Some of you might be able to go further, but I'm going to set it up as though you had some knee issues. And then you could take a towel or a blanket and roll it up. And then you're going to stick that behind the backs of your knees. And then you're going to take 2 blocks stacked like this. If you didn't have blocks, you could use big books or maybe a little stool. And you're going to bring your ankles on either side of those blocks so you have something to squeeze. And you're going to get them as close to that bolster as you can behind you. So if this is not enough and you feel pain in your knees to do this, you'll take another block and stack yourself up higher and put another towel behind your knees. And you're going to walk your knees close together. They don't have to touch. I actually like for knee issues to have them slightly apart. And if it feels more comforting for you, you could take another blanket and find the right dimension of roll. You can unroll it a little if it's too big, and you can bring it between your thighs. So again, just something to create an equal space between the thighs. And then you're going to spread out your toes and look at them, and make sure the feet, you can even untuck the pinky toes, set those up. So the feet are nice and flat on the tops of the feet, and you can really push down into them. And then you're going to think of, especially the calf muscles, pressing in towards one another to create this nice little lift and support. So you feel the ligaments and the muscles working around the legs. And then you can stay right up here. You're going to curl your tailbone forward slightly, or you might be able to lean back slightly and find that bolster. Now again, if it's too far back and it's too much flexion in the knees, you'll have to set yourself up a little higher. You can either fold your hands on the front of you. You can let them hang. If I was going to be really luxurious, I'd set up extra bolsters here for my arms. And then you're going to stay there, but you're not completely relaxed. The lower body is still working. So you're still hugging the ankles in, hugging the thighs together, internally rotating the inner thighs, and pressing into the tops of the feet. So while it looks like I'm having a great time, I'm actually working a great deal in this lower portion. So I hope that helped, especially just bring a little awareness to those knees, make sure they're always upright so that you're using both ligaments to the same degree and you're not creating an imbalance in those ligaments. Have a great day. Namaste.